Imagine waking up and completely unable to move. You can't speak, can't even blink, trapped inside your own body. This isn't a nightmare. It's locked-in syndrome, one of the most terrifying medical conditions known to humankind and science. But what is causing this terrible problem? And is there any hope for recovery? Stay tuned to find out. Welcome to Levitas. What is locked-in syndrome? Locked-in syndrome is a rare but catastrophic neurological disorder where a person is fully conscious but completely paralyzed, except for eye movement. The brain remains active, thoughts remain intact, but the body is unresponsive, turning the individual into a prisoner within their own skin. This condition results from damage to the pons, a critical part of the brainstem that relays messages between the brain and spinal cord. While the higher cognitive functions remain unaffected, the body loses all voluntary muscle control except for the ability to move the eyes or eyelids. Unlike coma or a vegetative state, people with locked-in syndrome are fully aware of their surroundings. They can hear, understand, and even think clearly, yet their inability to respond makes diagnosis challenging. Many cases are mistaken for brain death or coma, leaving individuals misdiagnosed for weeks or even months. Let's keep exploring more about this horrifying condition. What causes locked-in syndrome? The primary cause of locked-in syndrome is brainstem stroke, which cuts off communication between the brain and body. However, other conditions can also lead to this devastating paralysis. These include a traumatic brain injury, or TBI. Severe head trauma can damage the pons, disrupting signals between the brain and spinal cord, leading to complete motor paralysis. Brainstem tumors. As tumors grow in the brainstem, they compress and destroy nerve pathways, blocking motor function and leading to progressive paralysis. Neurological disorders include conditions like amyotrophic lateral sclerosis, also known as ALS, or multiple sclerosis known as MS, can gradually deteriorate brainstem function, mimicking the effects of locked-in syndrome. Toxins and drug overdose also play a role. Certain poisons, such as snake venom, or excessive sedative use can impair the nervous system, causing temporary or permanent lock-in effects. Lack of oxygen, also known as hypoxia, cardiac arrest or respiratory failure can deprive the brainstem of oxygen, leading to severe damage and, in some cases, locked-in syndrome. Understanding these causes is crucial in recognizing, preventing, and treating this syndrome before it becomes irreversible. How common is it? Despite its horrifying nature and by luck, locked-in syndrome is extremely rare. It is estimated that only 1 in 1 million people will develop this condition each year. However, due to misdiagnosis, the real number could be higher. The majority of documented cases are found in individuals who have suffered severe strokes or traumatic brain injuries. Cases are more commonly reported in Europe and North America, where advanced medical imaging helps identify and track patients more effectively. However, in developing nations, many cases likely go undiagnosed due to a lack of medical resources. Age also plays a role. Most cases occur in older adults suffering from vascular disease, but younger individuals can develop the syndrome following a severe accident, infection, or neuromuscular disorder. Because many people with locked-in syndrome cannot communicate initially, they are often misdiagnosed as being in a coma or a vegetative state. This delay in diagnosis can reduce treatment options and worsen long-term outcomes. Can people with locked-in syndrome feel pain? Yes, pain perception remains fully intact. Despite their paralysis, individuals with locked-in syndrome can still feel pressure, pain, temperature changes, and discomfort. This makes their condition even more distressing because they cannot move, scream, or indicate distress. Pain can come from muscle atrophy, bed sores, or nerve damage, making proper positioning, therapy, and pain management critical for their quality of life. The ability to feel pain is also an important diagnostic clue, helping doctors differentiate locked-in syndrome from other states like coma or brain death. How is locked-in syndrome diagnosed? Diagnosing locked-in syndrome requires careful neurological examination and advanced imaging exams. Clinical observation: if a patient appears unresponsive but can move their eyes, doctors suspect locked-in syndrome. Observing their ability to blink or look up and down is a key diagnostic step. MRI and CT scans. These imaging techniques help detect brainstem damage, strokes, or tumors affecting the pons. Electroencephalography, also known as EEG, it's an exam that measures brain activity, distinguishing locked-in syndrome from brain death or coma. Functional MRI, or fMRI. This test maps active brain regions, proving the patient is fully conscious despite paralysis. Brainstem reflex tests like checking pupil response, eye movements, and cranial nerve function helps confirm the diagnosis. Early recognition is vital to prevent misdiagnosis and start communication therapy as soon as possible. Can people with locked-in syndrome recover? Recovery from locked-in syndrome is rare, but it can be possible, especially in partial cases where some motor function remains. Intensive physical therapy, speech therapy, and neurorehabilitation may help regain limited movement. Some individuals recover the ability to move fingers, arms, or even speak after months or years of therapy. However, in complete locked-in syndrome, recovery is far less likely. Breakthrough treatments, including stem cell therapy and brain-computer interfaces, offer a future and hope. How do locked-in syndrome patients communicate? Most patients communicate through eye movements and blinking, using specially designed spelling boards or computer-assisted devices. Eye tracking technology allows them to form words and sentences, enabling conversations and decision-making. Some patients use brain-computer interfaces, also known as BCIs, where electrodes detect brain activity, allowing them to sort of type using mental commands. Also, advances in AI-assisted communication are making interaction faster and more accessible. Is there hope for treatment? While there is no cure in today's modern medicine, emerging treatments offer hope. These treatments include neuroplasticity therapy. An intense rehabilitation may help retrain neural pathways and restore some motor function. Brain-computer interfaces, BCI devices that convert brain signals into commands allow patients to communicate and control technology. Stem cell therapy is an experimental treatment that focuses on using stem cells, aiming to repair damaged brainstem areas, showing early promise for these individuals. Electrical stimulation. New studies suggest that stimulating nerve pathways may restore some movement over time. These innovative approaches bring hope that locked-in syndrome may one day be treatable, and who knows, even reversible. In conclusion, locked-in syndrome is one of the most terrifying medical conditions known to modern science, trapping a fully conscious mind inside a paralyzed body. Unlike coma or a vegetative state, individuals remain aware, able to feel pain and emotions, yet completely unable to move or speak, except through eye movements. This horrifying condition is most commonly caused by brainstem strokes, but traumatic injuries, tumors, and neurological diseases can also lead to its onset. Although rare, the syndrome is often underdiagnosed, particularly in areas with limited medical resources. Many cases are initially mistaken for coma, delaying crucial interventions. Advanced imaging techniques such as MRI, EEG, and fMRI play a vital role in differentiating locked-in syndrome from other neurological states, allowing for earlier diagnosis and management. Despite the grim prognosis, some patients experience partial recovery through rigorous rehabilitation, neuroplasticity training, and cutting-edge assistive technologies. Eye-tracking devices and brain-computer interfaces provide a means of communication, restoring independence and improving quality of life. Research into stem cell therapy and electrical stimulation offers a glimpse of future possibilities, though no definitive cure currently exists. The ability to feel pain underscores the urgency of proper care, ensuring that patients do not suffer silently. As medical advancements progress, the hope for more effective treatments grows stronger. While locked-in syndrome remains a daunting condition, increasing awareness and research efforts bring promise to those affected, offering a path toward improved diagnosis, communication, and potentially, one day, recovery. Thank you for tuning in to Levitas. Please share today's video with friends and family, comment, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated, it helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So, stay healthy, stay happy, and keep going.